Let's just stay with the quality of research, because we saw the big CAS review out of the UK, hugely significant, very comprehensive. It's led to a ban on puberty blockers for children in that country, upheld, of course, I said last night, in the High Court. We've had a review in Australia. We've had one in Queensland. This is in relation to, gender policy in that state. I know you've been stood down from the hospital up there because you've advocated care. You want a fair income review. You don't think the review by the Queensland government has been impartial. What can you tell us?
Yeah, it wasn't impartial. 4 out of the 7 panel members were known advocates of gender-affirming care, which means that what's happened is that they've failed in their major task, their most important task, which was to ensure that the model of care for the gender clinic going forward was safe and evidence-based. And they haven't done that. They've recommended that the paediatric gender services in Queensland continue with an affirming approach. But when you look at the 25 recommendations made in the evaluation report, you can see that they're trying to fix a clinic which is in crisis and providing a very poor standard of care for patients. So the recommendations are targeted at problems like that the clinic is professionally isolated from every other medical service. It's not being overseen by very important quality and safety networks like Clinical Excellence Queensland. It's not doing adequate, it's not giving information, communication with referrers is inadequate. It's not doing good handovers when it discharges patients. There's a lack of clinical leadership in the clinic, and they're not doing any monitoring of long-term health outcomes for their patients. So it's just concern after concern after concern, and it paints a very frightening picture. And the other thing the evaluation report does is talk about how it's actually a nightmare to work at the gender clinic. So it talks about staff being very stressed, burnt out, feeling constantly under scrutiny, and feeling like they're subject to reputational risk from working in the clinic. And so that's led to some bizarre recommendations. For example, they want to hire a consultant to figure out how to boost morale in the clinic. And they want to do a public education campaign where they try to convince Queenslanders that they shouldn't be concerned about these harmful gender interventions being provided to children.
Well, we know around the world they are. We are indebted to you, Dr. Spencer, for shining a light continually at risk of your own career on this issue. Thank you for your time tonight.